Hi, I'm Melanie, and today I'm going to give you some common troubleshooting tips for a couple different types of hearing aids. When you get hearing aids, your audiologist should inform you on the basics of cleaning and everyday care, but when I was younger, my parents wished they had another place they could revisit that information. I hope this video can be a helpful resource to you in case you can learn something or use it as a reminder whenever you need. Just as a little preface, everything I'm going to say here is from my experience, and before you do anything, please make sure to ask your audiologist if there's anything specific you have to do for your technology. I'd say the most important thing is regularly cleaning your earpieces. Normally, the hairs along the inner ear work to remove wax and debris, but when you have something in your ear, such as a hearing aid, it prevents this from happening, so you have to do it yourself. Now, before I talk more specifically about cleaning, I like to address the problem at its source. If your ear has too much wax, then just cleaning the hearing aid and putting it back will only get it dirty again. So the best long-term solution is to keep your ears clean. I recommend using eardrops to loosen up wax, and then use a bulb syringe or a water flosser on a very low pressure setting to gently remove the rest of the pieces. However, that can be pretty time consuming, so nowadays I just rinse them out in the shower with warm water and a little soap. I really hope this doesn't need to be said, but never, never, never use Q-tips in your ears. Yeah, they get a lot of wax out, but what you don't see is the amount of wax that gets pushed deeper into the ear. This can damage the eardrum and make your hearing even worse. This goes for any physical object as well, tissues, cotton balls, I don't know what people use. You can use those on the outer ear, but for the inside, just please flush it out with water or eardrops. Well, now that we've got that over with, I regret to inform you that you'll still have to clean your hearing aids. So don't worry if you clean your ears every day and there's still wax coming off onto your ear molds, because that's completely normal. In fact, cleaning your ears too frequently or too harshly, or using Q-tips, can actually give you more earwax because your ear is trying to protect itself from irritation. Alright, I'll start with ear molds. They're a bit bulky, and if you have clear ear molds like I did, then you will quickly notice staining. This is actually fine, as one of my previous audiologists used to say, having stained ear molds is proof that you're actually wearing your hearing aids. The only thing you need to watch out for are these dark blobs that can clog up the airways. Not only are they disgusting, but if the tubes are blocked, you can't hear as well. Thankfully, ear molds are squishy, so most of the time you can just squeeze them out, but if something is really stuck in there, you can remove the ear mold and use an air puffer to blow it out. Ear molds are also washable, so if all else fails, you can soak them in warm water with a bit of soap. Just make sure they're completely dry before you use them again. Now, you'll notice that my ear molds have a smaller hole in addition to the hole for the tube. Because ear molds completely block the ear, sometimes wearing them can result in ear bubbles that create uncomfortable pressure and inhibit hearing. This little hole is a vent that prevents those bubbles from forming by providing an outlet for air that may be trapped behind the ear mold. If a patient's ears are too small, their ear molds will be too small to fit this airway. But if you do have it, it can be cleaned using a thin wire provided by your audiologist. If you or your child has receiver in the ear hearing aids, like the ones I'm currently using, they won't have ear molds. Instead, they'll have this removable earpiece called a dome, which is a lot smaller and easier to clean. All you have to do is wipe it down with a tissue, squish it to see if any wax comes out, and you're good to go. You'll notice this little white thing under the dome, which is a wax guard for the receiver. This protects the tiny speaker in your hearing aid from the earwax. If you have RITE hearing aids, your audiologist should inform you on how to change your wax guard, but I'll show you mine. I was instructed to switch out mine every month. This disc can hold 8 wax guards, which means each one of these lasts me about 4 months, or it would if I actually remembered to use it. Please don't be me. Please don't forget to change your wax guard. Even if it doesn't look like anything's in there, I promise it makes a difference. It's kind of like how some people don't notice how dirty their glasses are until they clean them. You'll hear better. Alright, that's it for today. If you found this helpful, feel free to check out my other videos. I work really hard on these and would very much appreciate it if you could stop by. Thanks for watching, and until next time.